Hello. Today we have the privilege of speaking with Professor Suranjith L. Seneviratne, an esteemed immunologist and the newly appointed president of the Sri Lanka Medical and Dental Association in the UK. Renowned globally for his research in immunodeficiency, autoimmune diseases, allergy and immunogenetics, Professor Seneviratne has published over 300 scientific papers, including work in journals like Nature and Science. Hello, Professor. How are you doing today?
Fine, thank you, Thaliba. Thank you.
What initially inspired you to pursue a career in science, specifically in immunology and allergy?
I think from a very small age, I was sort of interested in, I had some sort of interest in medicine, but it was in school time, it was more sports, cricket, lots of cricket at St. Peter's College, Colombo. And it was cricket because my dad was a cricket coach. So because of that, I fell directly into that. And then suddenly there was a change where I think I decided to do some studies and then got into medical faculty in Colombo. And from there onwards, I really concentrated on medicine. And passed out from Colombo.
Yeah, and passed out from a Commonwealth scholarship to Oxford University.
Yes.
And talking about that, could you share a bit about your journey from Colombo University to Oxford and how those experiences shaped you yourself today?
So, at medical faculty, I really concentrated on medicine, came top of the batch. And then I was very lucky to join the University of Kelaniya as a junior lecturer, and I did quite a bit of research whilst there with two very good mentors. That's Professor Janaka De Silva and Professor Saman Gunatilaka. So that started me on the pathway, the journey to do good research. And using that together with my undergraduate, the grading that I got in undergraduate allowed me to get the open Commonwealth scholarship to go and to either Oxford or Cambridge, and the Commonwealth Association selected me to go to Oxford, and that was my first foray into immunology. That's how I went into immunology, because the professor that I was assigned to work was a professor of molecular immunology, world-class molecular immunology. So I fell into immunology at that stage, 25 years ago, exactly 25 years ago, 1999.
Oh, nice. And also, did you realize that you are more passionate in immunology, or how did that happen?
I think at that time, this is way back, last millennium, immunology was not something that was really well known in Sri Lanka. So even at that stage, when suddenly I realized that I was doing immunology, people back home were wondering, what is this subject? You're a clinician, why are you doing immunology? And since that time, the research was wonderful in Oxford. And then I also did clinical immunology, because I did research immunology, got my PhD, and then also did clinical immunology, which is further training, because we didn't have a clinical immunology program here. And then from there, I went as a consultant to Imperial College.
Oh, that's amazing. And back in the day, a scholarship to the Oxford University must be a huge achievement. As the new president of SLMDA, congratulations on that. What are your primary goals for the organization in the coming year?
So the SLMDA, Sri Lanka Medical and Dental Association, has been an organization run by doctors who migrated to the UK and who are really interested in giving something back to the country. And so initially it was focusing more on doing fundraising events there, getting the money and providing textbooks to the different medical faculties and dental faculties back home in Sri Lanka. And now it has expanded a bit more, because with the financial crisis, we give some bursaries. In addition, we have also provided some research grants for students. So we have just expanded a bit more. And the liaison, or sort of a joint work with the professional organizations in Sri Lanka, like the College of Physicians, College of GPs, because I think there can be a lot of transfer of knowledge across. What we know, we can pass back here. What we learn from here, we can be passed to and fro. So that is the sort of remit of the Sri Lanka Medical and Dental Association, which I became the president in May for 1 year.
And you published over 300 journal articles, an impressive feat. How do you approach balancing clinical practice with research?
So a lot of our research questions arose. That's the nice thing of doing research and clinical medicine, because when you see the patient, immediately, if you just take on the toe of, as a toe, right? You take it, then it becomes, you're not really, you treat the patient becomes better. But if you take it as a challenge, each patient has their own challenge. There are certain patients who will improve in one way, another group of patients would really not improve in that way. If you take those questions and try to take it back to the bench, that's the important thing. You see it in the clinic, you take it to the bench, find a solution, the best solution, take it back to clinic. And I think that is the good thing of doing clinical immunology and research immunology, because there is this sort of cross-link between what we see in clinic and what we find in the research. And most of our studies have been focused on patients rather than there are molecular studies too, genetic studies, but it has been on diseases and patients. Even in Sri Lanka, on dengue, a very important condition, which we have used some of our knowledge, the immunology knowledge, to work on a condition that is important for Sri Lanka.
So with immunology advancing rapidly, what emerging trends or technologies excite you most for the future allergy and immunology?
I think it's three things. One is genomics and proteomics. Basically sort of understanding the genetic, and from the genes you get proteins to make us function, that effect. So that is very important. Genomics, proteomics, metabolomics, that's number one. Number two is bioinformatics, because it's using technology, computer knowledge and biology, combine it and having bioinformatics, because so many things can be predicted for the future. It's like the people who won the Nobel Prize this year, etc. They were using similar sort of pathways to advance the area. And the third one is AI. That is used in a correct way, used in a regulated way, that is going to revolutionize medicine in a big way. And it is going to help personalize treatment and to provide what we call precision medicine. Because previously, when I was training in Oxford way back, many years ago, you use the same treatment for everyone. Now, using these technologies like genomics, proteomics, you can stratify groups, you can divide groups. This group will receive this treatment, they'll do best. The other group will receive another treatment. Why do you want to expose them to harmful treatments that has no benefit? So precision medicine, personalized medicine is developing on the back of these other advances.
What advice would you give to a young medical student or researchers aspiring careers in immunology and clinical research?
Do what you like. That is important. If you like to do surgery, be a good surgeon. Firstly, children in school, don't do medicine because your parents tell you to do medicine.
That's a huge thing.
That is absolute, because when you're 50 years, when you're 40 years, you have to go to work, you have to enjoy the experience. You have to go there. If you're angry when you go to clinic, you'll be angry with the patients, and what have they done to get that anger? You have to be happy, get up in the morning, go to clinic, get your career. So if you like medicine, get into medicine, work hard, get your qualification, and then select your field, and always take it as, people come and tell you their problems. We are problem solvers. We cannot solve all problems, but we can cure certain amount of people, we can care for them and always be caring for them. So what I would tell young medical students is do your career, but remember that getting qualifications is not the only thing. Always have it in your heart that you're dealing with people and treat them with compassion, because even if you can't cure them, you can give them so much of hope and care, and that is important as a doctor.
Thank you so much, Dr. Suranjith. This was a very insightful conversation, and all the best with all the future work that you're going to do with your organization. Thank you so much.
Thank you very much.